Okay. All right. So I think rather than everyone go through and introduce themselves, because we're going to have a lot of people, when you make a comment or if you asked a question, if you would please just say your name and either what practice you're from or what school you are the school nurse for. And then that way we won't, spend a lot of time on that. We're going to pretty much run through this algorithm quickly because it's extensive and everybody has seen it probably in all of its iterations. So what we want to really focus on is the parts of the algorithm where there is still some confusion, and see if we need to suggest any changes to the VCHIP team. And then in addition to that, we want to talk about how we're going to communicate, how the school nurses and the providers are going to be able to communicate back and forth about students and what parts of the tool really, point the way for that, and if we need any other tools in addition to that. So if everybody has an idea, or want to put the agenda up, in a window on your own screen, that would be fine, because I'm going to take this down now, and I'm going to put this algorithm up, not that one.
Karen, your screen was not sharing a minute ago, so if you want, I could pull the algorithm up. Is this still version 2?
No. Wait, just let me find it.
Okay.
That's it. Can you see my screen?
I just see you, Karen. I'm not seeing your screen. There you go.
Yeah, I don't think it's gonna work. Oh yeah, maybe that'll help.
Share it.
And you'll have to make it bigger, Karen.
Well, somebody's underwater. Okay. There we go. How's that?
Let's see if it works better.
Can everybody see that?
Oh, yeah, it's better.
Okay. So I just want to point out, this is the version as of August the 26th. We've already had a couple of suggestions for changes. So this is going to change. Don't print out 100 copies of this, anything like that. So everything about this document begins with this box right here. The exposure to a known, in other words, a confirmed COVID positive patient, confirmed with a PCR, or someone who has had high risk travel, meaning they've traveled to any place that has that is in the kind of the red zone, people have been calling it, or if they've gone anywhere on public transportation. Even if you've just gone to West Lebanon, but you did it on a bus, that's a high risk travel. So we have to make sure that we're inclusive in our definitions here. So if someone is in this high risk, is in this box right here, if they've had this exposure, a known exposure, or they've had high risk travel, that automatically puts them in a higher risk category. So we're going to follow a different pathway for those people. But before we do, I'm going to go to the second pathway, which is somebody who doesn't have any particular reason for you to suspect that they have COVID so far. So we're going to go to page 2. And again, that's the same question. And if they are going to look at the symptoms, and thanks to Allison Conyers, we are going to be adding nausea and vomiting to this. I found out that the reason it wasn't on here is because they couldn't fit it on the little box. So I think we're going to get that corrected. If they have any, do they have any of these symptoms? If they don't, then they go to school. You know, you can follow your normal policies, you know, that you would normally follow for a kid who has a rash or an earache or joint pain or anything like that. And in addition to that, if you have a student who has a known allergy or a known diagnosis of asthma or gets migraines or, you know, breaks out in rashes for some reason, then this is a student that you can have a pretty good suspicion that this is the normal thing for this child. And it's not necessary to send that child home. You can observe them. You can call them back in later in the day to take their temperature again if you feel more comfortable doing that. But you don't have to send them home or exclude them right off the bat. You're going to have a little bit of time here to think about it, investigate. If it's a kid with a migraine, ask them, is this migraine like the ones you usually get? Do you have any auras with your migraine? You know, just some more questions. And hopefully that's going to be the 99% of your kids are going to fall into this category.
Oh, Karen,
if you have someone who has one of, yeah,
just
go
really
ahead.
quickly, there's a question. Are you keeping headache? The CDC removed it from the list. So since you're talking about that now.
We are keeping headache. We're not necessarily following everything that the CDC is saying because, you know, there's some differences, and also because, you know, as we keep reminding everybody, Vermont is kind of a special case because of our very, very low incidence in our population. So it's not normal for kids to have headaches. You know, I mean, if a kid says he has a headache, you're going to ask them the normal questions. You know, have you had anything to drink today? Did you go to the bathroom? When's the last time you had something to eat? And if the answers are unsatisfactory, then that's going to raise suspicion in your mind. So if we've got a kid got, you know, the hallmark COVID symptoms for kids, we're going to move down to this chart, and then it's divided into 3 boxes. And then that's where we have to start to get involved with, because just about in all the cases, you're going to refer that child out. So our providers are going to be getting lots more phone calls, and they're going to be needing to see a lot more kids probably than they're used to. But we want to have some kind of connection with the medical home for that child, because school nurses cannot diagnose, and this is a pandemic, so it's a different ball game that we're in this year. And you know, we're going to follow the rubric, the algorithm here to figure out what we need to do with that kid. At some point, we are going to need the providers to communicate back to the nurses. So one of the things that we want to decide in this meeting is what kinds of ways are we going to talk about sharing information. So I'm going to take this down, and I'm going to put up this other tool, this communication tool. Now, this is a work in progress. It's expected that we're going to change this. So if everybody's had a chance to look at it, I think we're ready to talk about something that you like, about things that you don't like, and what your suggestions are. So we're going to either open up the chat, or, you know, you can raise your hand, and you know, we will figure out, you know, what we want to do about this.
So Karen, I don't have the ability to raise my hand, but one of the things that I mentioned when I first saw this document was adding the child's birth date on the document, since that's usually a key field, birth date and then last name. So that would be really helpful if that was on there, at least from the school nurse side.
Okay.
And
I think that's a good suggestion.
If anybody hasn't used Zoom before, if you open up the participant window, there is a raise hand function on the participant window. And once your hand goes up, Karen can call on you, and then you can unmute and ask your question. And I see Anna has a question, Karen.
Okay. All right. How do I do that, Clayton? Just
So
unmute.
she can unmute herself.
Yeah, we'll ask you to do that. Just unmute yourself and ask your question.
Hi, everyone. So I'm envisioning that if the patient is in school and sees the school nurse and is sent home, the school nurse could be handing this form to the patient saying, we want your provider to send this back before you come. You need to see your provider and they need to send this back to us. I'm also envisioning that there's going to be a lot of kids who don't go to school the morning that they're sick and come to see us instead. And so we're going to need to be able to then print this form. And I'm already thinking that we need to just build it into the medical record so that we can print it easily from the encounter and then fax it to you all. The other thing, though, that I think we need is a direct line to the school nurse, or an extension, and something that says whether or not this is a confidential voicemail. Because what I have experienced when I have tried to call a school nurse to tell them what I'm thinking, it's very hard to reach them at the moment that I have a moment to call. And I'll sort of get into a phone tree and I don't really know whether I'm getting to a confidential voicemail or whether I'm getting to the front office or something. So it seems like we're going to need a paper with every school, the school nurse's name, their phone number, and yes, this is a confidential voicemail, so that we can just call, leave a message, and move on with our lives.
Okay, so I will ask them that question, but actually I was going to send them an email today and I just never got to it. So we're going to make sure that you have that. But I just wanted to verify that is it correct that it's you folks at the, Anna, do you know?
So Karen, you're breaking up. If you might want to turn off your video because your signal might be, yeah, that might help with your talking.
Okay. Anna, can you let us know, can you tell me, do you know if your if your email is secure? Can you send a secure email to a school nurse?
I want Jeremiah to weigh in on that. I know that we can type #secure and send it on our end. I always worry, though, about the security of the email address I'm sending it to. And so in general, I really try to avoid keeping patient health information in an email that's going outside of our UVM health network, outside of that network.
Okay,
so I would rather stay in fax.
Okay. Yeah, I think we've talked about this before, and there was a mismatch. Like their email is secure, but their fax may not be. So we were talking a while back about getting access through a portal in Epic, and I don't think that had happened. So yeah, I didn't see Jeremiah on here yet, but if he's on, please chime in. No. Okay.
Karen, can I just ask a question too? I know there's been a lot of talk on the VCHIP calls about just like communication between parents, providers, and school nurses, and not necessarily always having to write things down, but to just have this open lines of communication. Are school nurses in general just feeling like they really need to have a clear document? I'm just curious to get some feedback on that.
Yeah, I think that that's the general consensus, both from the health department and from the school nurses that I've spoken with. I haven't had anybody really pipe up and say anything different, but yeah, we do, because most parents are reliable witnesses and so forth, but there are some who aren't, and we can't have them in a position of having to decide which is which. So I think that we're going to need something, either them speaking in person to the physician or them having a written document. which they can then, you know, make a nursing note about. So, I mean, there are probably a lot of ways to do this, and I think that we just need to kind of, you know, explore some of the different options. Getting the phone numbers and the emails and the fax numbers to you is not a problem. I can do that. But I'll want to check with my nurses first and ask them if they know if does their fax come right to their computer? Does it come to a fax machine down the hall? You know, where does it come? And that's one of the things that we'll need to know. So all of those things are possible. I think it's just the idea that we need to make sure that there is a direct connection between from you guys back to the school nurses and the other way around too, because school nurses will often run into the same problem. If they try to call the office, they're going to get, you know, whoever's working the phones that day, and may or may not get through to you until the end of the day. And it's often going to be a situation where, you know, kid shows up at school, parent can't be found, they need to talk to you about this, you know, or whatever. So I'm just, you know, I'm just throwing ideas out there. So please, anyone else who has any thoughts on that, you know, unmute yourself and speak up or raise your hand. Clayton, I see your hand.
Yeah, so I was wondering from the fax standpoint. So if you have a fax machine that's in the principal's office, so the schools are driven by FERPA, not by HIPAA. So so a student record and a health record is part of that student record. So if it's in the principal's office and only minimal access to that office, so the principal, the admin assistant, and then they could give that to the school nurse, would that suffice for the confidentiality piece that the providers may have with going to a machine that's like sitting just out in the general public? Because I think in a lot of cases in schools, you'll find that that machine is in a place where it has some protections, because lots of things that come in would be considered protected health or protected information from the standpoint of an education record. And so they're complying with those same things. And not just anybody has access to that. And the folks that do are just distributing it. But and so if not, then faxing becomes problematic because we don't have money to put in confidential fax machines, or specifically in nurses' offices in most cases. And the other thing I wanted to add was when we were talking about the actual document itself, that document is very helpful when you go through the flow chart on the second page, and it talks about some of the different symptoms that are being seen. And if you have sometimes families are hesitant to go to their doctor for whatever reason. And if you don't ever and so then they're like, well, the fever went away, so they go back the next day, but there's nothing that says that it's actually resolved. This document would help fill that gap during this time of COVID, where we're really trying to be as vigilant as we can. And that was, I think, part of the reason why this document was designed.
Yeah, and I think the point about the medical homes having copies of this as well, because it came up on one of the VCHIP calls that, you know, you may not actually see this patient. You may actually have, you know, a televisit with this person, or just a phone call. And, you know, the child is better probably a little bit than the school nurse does. So you may pick up something that you think is perfectly normal for that child. So I think that you know, I think we can settle on, you know, that we kind of like this form after we do a little bit of, you know, toggling with some of the different parts of it, but, you know, recognizing that it may, in fact, have to be shared in a number of different ways. We do want to have a physical record, but it can either be something that, you know, the physician fills out and checks the boxes as a result of having a conversation with the school nurse, or that the school nurse sends, you know, faxes this to the doctor's office or some such thing. And, you know, that's how we keep the paper trail of the referral and the response back. So we need to do some work on finding a secure communication that everyone can use. we have the added problem with COVID. I don't know how many of you have been hearing these stories, but we do not want someone in the school other than the head administrator or the school nurse been diagnosed with COVID until it's time for them to know. So one of the things about this particular problem in this pandemic is that a lot of stuff is going to be held really close to the vest. And we're not going to be talking about saying someone has symptoms of COVID until they've had a PCR and it's been confirmed or not. And contact tracing has had a chance to talk with that family, because it could get really messy in a lot of the communities in our Central Vermont area here. So I just want everybody to kind of keep that in mind as well. So in terms of just faxing this into a school office, I have a lot of misgivings about that. I don't know about anybody else, but so
can I?
Somebody else have any comments about either the form? I'm sorry, what?
Hi, I just wanted to weigh in. I do have a comment. My name is Maria Malekos. I'm the school nurse for Callis Elementary. I have some misgivings about the form. It strikes me as something that looks really pretty in theory, but that is going to completely fall apart in practice. And given how difficult and complex this year is, with as many problem solving, so many pieces in the air, I want to think about the providers a little bit. I worked as a float nurse for CDMC before I became a school nurse, and I can tell you that these doctors have stacks of papers. All these providers have stacks of papers this high in their boxes at all times. I don't see a reasonable time management way to add 25, 30 pieces of paper to a provider's box on any given day and to get a realistic answer out of it. My other concern is if the providers are planning on phone triaging most of these parents, if we give a piece of paper to the parent to take to a provider that they're going to see via Zoom, and then the provider has a piece of paper that they print out, it's not the same piece of paper that we have sent with the parents. And then they're supposed to fill it out as though we originally filled it out, and then they fax it back to us, even though they didn't get the original piece of paper that we sent them. I see a lot of holes and having it fall apart, especially if different schools don't have secure faxes. I know our U32 COVID coordinator spoke to us about how we're going to loosen our restrictions this year in terms of verbal orders as opposed to written orders, because it seems like it would be a lot easier to communicate with the providers or the providers' nurses over the phone and get some real-time information versus trying to chase paper virtually and realistically. So without being a Debbie Downer, those are my concerns about the form.
Can I just say I have a few thoughts about that as one of the providers in the pediatric office. And I think that there are ways, and Anna can weigh in on this too, that we can streamline that process. I mean, even if we're not seeing the patient, I think we can do things within Epic, our electronic record system, to create a better way to communicate these things to you guys. And I don't necessarily see that as every provider that has to sign the form. I think it can be a nurse in our office that can fill it out and send it to, is what I'm envisioning. So I think there are ways that we can make that go a little easier from our office.
I agree with Kathleen, and am happy to create a template in our electronic health record that would just match this form. However, if we can't rely on faxing,
Right.
That's going to be a problem. So I have no problem faxing a form to a school that is in the principal's office or the whatever office. The cover letter says confidential, it says attention school nurse, and I'm sending it with the parent's permission. So from my standpoint, in terms of violating patient privacy, I'm sending it with parental permission to the school, and I have no concerns. If, however, I have to call, or my nurse has to call every time we encounter a patient from a school, I don't know how we can do that. I don't have the time to make these phone calls. And I'm worried that we would call, we'd leave an incomplete message, then you'd be calling back to try to get more detail, and I don't think it would work. So what I envision is if I see a patient in the office, like in person, I would print this form, hand it to them and say, can you get this to your school nurse? And I'd probably also ask their permission if we could please fax it. And I fax you all a copy saying, we're testing, we're not testing, here's my recommendation.
Yeah.
If I see them over televideo, I would ask their permission to fax the form to the school nurse. And similarly, if we do a phone call, we could ask their permission to fax. And I have no concerns about getting very comfortable just, oh yeah, I got to fill out the form. We do it quickly, we print it. It's just like faxing asthma action plans and stuff like that. It'll be annoying, but doable. But if we start having trouble on the other end with not wanting anything COVID related coming through on the fax, because it might start rumors now, then I think we really have to think about a different work.
Yeah. And it would be fine if you folks, wanted to develop a form within Epic. I think we'd need to make sure that it has the same, it has all these same things. And then the critical part for the school nurse is that they need that parent's signature, or the parent has to bring it and hand it to them, because it allows you to talk to the school nurse. FERPA doesn't allow the school nurse to talk to you. It's simple. Unless they've got a signed parent permission, it's a barrier that is something that we struggle with every day. So, that's why we have this statement down here, because they need to understand the mission specifically, in this case, for the school nurse to be able to provide information to you, to someone outside the school about their child. So, I mean, I don't see that, I'm not particularly wedded to this form, and I don't think anybody is. It's just that it was just something they drew up quickly to make sure I had, a lot of it, contact information. Sorry, what was that, Clayton?
Dr. Greenberg has her hand up.
Okay.
I'm at the CVMC Peds Clinic also, and I mean, I think on our end, we are very much going to have to come up with a protocol for how to triage out these faxes as they come in. And my concern is that there might be a bunch of faxes that come in that are not necessarily correlated with visits, or that we're going to have to then work to arrange on our side to get a visit going if the parent doesn't self-initiate that. The piece of paper, I agree, is going to be a bit of a problem if we don't have a seamless way to get it from the nurse's office to the parent to us with the correct signatures in place and having it be the same form. But I think we are going to have to figure out a method of communication one way or the other. I am kind of concerned, though, that we're going to end up with a pile of faxes from the school for kids who've been sent home for various reasons that may or may not correlate with the kids who actually call our office looking for an evaluation. And we're going to have a plan for how we follow through on that in a somewhat timely manner.
Yeah. All right, and that's one of them that we had back a while ago about this follow-up, is because the guidelines for the school nurse specifically state they can't just let a kid back in school. They can't. They have to have a clearance, or they have to be able to, certify that they've met the criteria to be allowed to come back in school. Because the whole point of all of this that we've been doing and talking about for months is we've got to keep COVID out of the schools the best we can, for as long as we can. And that includes, kids having to stay home for 14 days when their parents just don't want to call the provider and have a conversation. So yeah, I agree with you that, I think we're agreed on that we need to communicate. I think we just need to work on the nuts and bolts of it. Clayton, did you have a suggestion?
Well, so one of the things that within our district we've been trying to do, and Allison Conyers is on here too, and we had sent letters out to many of the providers that were right around our area and trying to make a connection with the providers and saying, how can we work together? So if we have a student that's ill, we can help the parent to get in contact with them and figure out what's the appropriate approach for that. And having, and I know that everyone's time is very valuable. But making that connection and understanding that process, the form is part of that. But it's more along the lines of making sure that we're communicating, because if the parent feels not obligated to go to the doctor, that the algorithm basically says the student stay home for 10 days. And so we were trying to make it so we can help the parent get in to either see the doc, or they can go to get a test if that's what's going to need to be done. But that's, and obviously there's issues with that too, but if we made those connections, it would be helpful on both sides. And if we have less paperwork, that's great, but it's having the time to talk on the phone. But if it could be nurse to nurse and the nurses are supporting the doctors and we have that piece of it, sometimes that in itself is helpful.
Yeah, and I think too, we're gonna have to all work on training our parents that they can't just call up the doctor's office and say, I need to come and see the doctor because my kid has a cough. I mean, they have to be able to say, the school nurse sent my kid home because they have a symptom of COVID, and then that should, alert whoever it is that's taking the calls in the provider office that, okay, this is a kid that needs to be seen, and they need to be seen now. They can't be seen, in 3 weeks or whatever. So,
Well, just
so that's
to
going to
clarify, they don't have to be seen. I mean, they have to be, we have to come up with a disposition. So our workflow in our office is that if a patient has a symptom of COVID, step one is we triage that patient based on our normal pediatric telephone triage, not thinking about COVID at all, but just thinking about, does this kid need to be in the emergency room? Do they need to be in the office? Can it be safely managed at home? Mm-hmm. And step two, after we've come up with that disposition, then we can think about COVID and return to school. And so for some patients, the triage disposition will be COVID test and stay home, in which case what I would be envisioning is getting parental permission over the phone to fax this form to the school nurse, fill the form out saying we have not seen them in the office, we've recommended testing, and just fax it directly to you. I'm wondering why there's the necessity for the parental signature on the form, because that's going to make it a lot harder with video visits or phone calls.
Okay.
I'm sorry, Karen. Ellen has her hand up, and I just wanted to make sure that we got to her.
Yeah, see the hands, Clayton. Do I have to stop sharing?
I unmuted. Can you hear me?
Yes. Yeah.
So I'm Ellen Nadinger. I was a school nurse for 15 years, and now I'm a pediatric nurse practitioner, which I've done for the last 2 years. Karen, is the concern regarding the parents signing the bottom of this form, is that so that it's allowed that the school nurse communicates with the PCP? Am I understanding that correctly?
Yes.
Okay.
So a lot of all of our schools, Ellen, as you know, send home a health form, and all of those health forms should have a request for the parent to sign permission for the school nurse to talk to the child's medical home, primary care provider.
Right.
A lot of parents don't sign it, or a lot of parents don't return it. So we need to have another gap filling step there, because this is not business as usual.
Could I just make an interjection here? My supposition would be that the majority of school nurses probably have more than 90, possibly even 95% of the parents signing that form of which you speak. And so that this form, the signature there, would be germane only in a few instances. And my guess is that those school nurses know exactly which parents would need this additional signature. So getting back to some of the providers who've already spoken, it seems to me that if we have the school nurse calling, say Karen Hart calls my office directly and says, Ellen, Susie Smith has these symptoms, X, Y, and Z. I have permission from the health form signed at the beginning of the year to speak with you directly, and then we carry on from there. Would that be satisfactory, Karen?
Let me hear from my school nurses. What do you guys think? How many of you are comfortable with that, and how many of you have enough permission forms that are not returned? I see Lynn, thumbs up. Ellen or Elizabeth, thumbs up.
I would make a comment on that though, is so we sometimes have signed forms that we will provide, and then that signed form doesn't, as long as the original signed form that we get goes into the medical record of that student at the practice at the beginning, then they can go back and reference it each time, and then we don't need the signature of the parent because we've already made that connection.
Right.
A lot of times that doesn't seem to happen, and therefore we're constantly refaxing the same document. And so if we've already made that connection, if there's something with the new system, maybe there is, that's already on file. When we send that, it already says there's already permission from the parent for the provider and the school nurse to have a conversation. And then it alleviates some of the other pieces, because we do have some that parents that will just refuse to provide. They don't want the two to connect, and it makes it very, very difficult when the school nurse is really trying to protect everybody and not just that one student.
Right.
Yeah.
It's usually very few.
Yeah. And those kids are just going to sit home for most of the school year. We can't do anything about that. It's up to the parents, you know. But the other thing is, I just wanted to point out too that we talked a while ago, and I don't know where we are with this, but when you all were getting Epic, we talked about having a field in Epic to put the child's school and the name of the school nurse, and on intake or at your yearly checkup or when at some encounter, you would get permission from the parent to talk to the school nurse, and that would be in your record as well. So I don't know if that ever got, you know, operationalized or not, but that was a discussion we had a couple of years ago when folks were first starting to get Epic.
That is not a workflow
So there's
that we have
another
implemented.
Yeah, that's what I thought. School nurses, any other ideas about how to communicate with you?
So the whole U32 district asks for permission. Certain communities ask for permission. We have an ROI that we ask them to send out. Certain communities have less compliance with that than others. Some parents just say no. My thought this year was to communicate with the parents who, when we get those back, that do not give that permission, to give a quick telephone call and explain to them that that is 100% their prerogative. But this year that means an automatic 10 to 14 stay home for your children if we cannot communicate with your medical home based on the guidance from the state that we have that allows us to open schools. And I suspect that most people will sign it. That's quite an incentive to get their kids back in school, I think. But I think we have a lot of people who pick up kids for friends, or grandparents who pick up, or teachers who take other people's kids home, and they don't have the permission to sign an ROI right there if we send people home. I just see, that there's a lot of hiccups on that one. I think if we get it at the beginning of the year, it will be a whole lot more effective. And then we can send it as we need it.
Hi, this is Megan Spalding. I'm the school nurse at Union Elementary. I just, the whole thing with the form for the parents that don't sign, I don't think that means that we, can't still make connections with the medical home. I think that just means that maybe there's some lack of understanding there, or maybe the parent's not feeling comfortable for whatever reason. But that doesn't necessarily, to me, mean that, if a child is having symptoms of COVID, that parent, you can't have that relationship with that parent and say, hey, I really need, you know, a fax from the medical home with directions. So I think, you know, it doesn't mean to me that it's an automatic, you know, 10 to 14 day wait. I think there just needs to be some extra communication.
Anybody else?
Hi, everybody. I'm Erin. I'm a school nurse at Berlin. And when our school has had some issues with the preschool primary care forms, I have faxed over the blank forms with the permission. Would it make sense if we have that permission from the parents to just fax it to the doctors, or is that just too much clutter? Like if they don't call, they'd rather their kids stay home for 2 weeks.
Karen, Dr. Greenberg does have her hand up, and
I wasn't specifically answering that one. So if somebody wants to get to that first, I mean, I think my take on that would be that it's probably better for us to at least have the information that the child has been sent home, but it is going to require us creating a workflow to figure out what we're going to do with forms that don't match up with phone calls that we've received, essentially. And then the question that I was going to ask was, how well publicized has this algorithm been for the families? I mean, I've been sort of explaining the gist of this to families at well child visits and other things so that they have a basic idea about what their kids are going to get sent home for and kind of what the rules are going to be or the ground rules are going to be. But I don't feel like many families are very familiar with this. I'm a little worried that for a lot of families, it's going to come as a bit of a surprise that their child either has to be tested or will be out of school for a 10-day period. I mean, I think it's absolutely medically appropriate, but I also think that in our office, we've been getting a lot of pushback and sort of surprised reactions from parents when you get to the point of saying, so now we should be talking about whether to COVID test your child. It's just something a line they haven't mentally crossed until that point. And I think that as much as possible, if we can kind of disseminate the algorithm to families in some understandable form so that they have an idea about what kinds of symptoms are going to be getting them it recommended that we think about doing a COVID test, it will at least help break the ice on that topic.
Yeah, I agree 100%. And we had been hearing that there was a form in production, so to speak, that would simplify this and give parents the same information. I haven't seen that yet. And we were specifically asked not to share this triage tool with parents because it's not done and it's complicated, and we didn't want school nurses to be inundated with a bunch of, and providers really, to be inundated with a bunch of questions and complaints really about the form before we were really even on the same page with it. So Clayton, go ahead.
So in the last couple of weeks when we had our town halls for the Vermont State School Nurse Association, Dr. Holmes has spoken to this. And the main gist of the actual flow chart and the algorithm was that it's very medical in nature and it's diagnostic in nature. And so giving it to parents, but we believe, and I don't think I'm misspeaking here, that a more simplified explanation of how that form is that would be more generalized to provide with parents is forthcoming. And that would be very helpful. And I agree that the parents need to understand the process, but the document as it's written, unless they have some medical understanding, there are things on that may or may not make sense to them. And I don't mean to belittle that, but that it can be a little bit confusing. So having an intermediate document that was shared with parents was very helpful. But the school nurses were several times we were briefed not to share it directly. We know that it's going to get out there, but the idea was to have something a little bit simpler that we would share with the families to understand the process. And
No,
then,
absolutely. The algorithm is not designed for the parent level, but there has to be something user friendly that we give to them that basically just at least gives a list of sort of symptoms that may trigger this kind of discussion, or, you know, these are things to be watching for. I mean, they're getting these screeners when they're coming to school already, so they probably have a pretty decent idea of what symptoms we're looking for. But Jesse, I see your.
So I got a form, I don't even remember where I got it, but it was somewhere in the Washington County, and it's not on my computer, but it looks like this. And apparently that's what parents are gonna get, or what they're planning on giving parents, that says daily screening flow chart, no flags, proceed to school, and then it goes like exposure, what do you do? Diagnosis of COVID, stay home. And then it has a list of symptoms. It's a lot simpler than the one that we have that we're looking at as providers, but it has most of the information in a very simple form. So I don't know who owns this. I had it in my email, so I can dig back and see who sent it to me. But it's helpful. Sorry?
I was just asking if it was Elizabeth.
I actually think I got it from my son's school, the head of his school, his elementary school.
I made that.
Oh, okay.
Nice. It's
For
really
U32.
helpful. I think it would be good for parents.
I made that for U32. I stole it from a North Carolina return to school algorithm. I couldn't copy it from a PDF, so I made it on Canva, but we did think it was a little simpler. So Elizabeth Worth and I worked on that to send out to the U32 folks.
So can you one of you send that to me?
Yep.
So I'll touch base with Brina in the morning and see if she wants to speak to this on the VCHIP call tomorrow. The answer that I got when I checked on this late today was, we probably should start to work on it ourselves. It didn't come from Brina. I didn't check with Brina. So I can check with her, you know, in the morning, and we'll see if they are in fact gonna release something in time. And if not, then I think that, you know, we can all, you know, we can just send this around, you know, send something around via email and have people, you know, make comments or whatever. But I agree that we need to, you know, I think we need to warn parents, really. I think that it needs to be something that they're expecting, and then that will help, you know, with the whole getting people to sign papers and filling them out and stuff that they normally wouldn't do. But I'm still waiting. I still like to hear some more suggestions from the school nurses about what methods of communication are the most secure and will work at your school.
I'm just saying that I'm totally fine receiving phone calls. I think a lot of school nurses have their own private direct office line and voicemail, and we can check in our district to make sure that we're all saying this is a confidential line, because I'm not quite sure about that, but we can fix that easily tomorrow if that's not the case. And also faxes. You know, we can look at that to see if we can get a private fax. However, in the meantime, a lot of our faxes are in, you know, offices where the teachers wouldn't have access to it, but, you know, we might have 2 secretaries and myself looking at that fax machine. And I feel like that's as confidential as we're going to get at this point in the game. But those are like the best ways to communicate with us.
So maybe what I'd like to ask the nurses is if all of you can send me an email tomorrow and tell me what the situation is in your school health office. I mean, I know this for the most part, but is your phone line direct? Do you have a fax machine that is secure enough? And yeah, just, just send me an email tomorrow and let me know what the situation is in your health office. And then we'll take a look at it. And if we're satisfied that we have this covered, then we'll just choose, we'll choose the method. And I'll put that, I can send that out to the providers with your phone numbers and your fax numbers and your emails. And then they'll have something to go by, and they can choose then how they're going to want to communicate.
So my sense as a pediatrician is that when I ask parents permission to send something to the school, my sense is that I'm asking them permission to send something private of theirs out into the bigger world. So I'm saying, can I send your school a letter saying you have been diagnosed with asthma? Yes. Okay, I will fax it to the school. So I'm at that point not really as worried about holding to the standards of HIPAA and having a fax machine in a locked office only seen by the RN in the school. When I am asking permission to call and leave a message with information, at that point, I feel as though that message that I'm leaving without parents saying, yes, you can tell them this, 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 and this, like I'm starting a conversation with another person via voicemail. I need to know that voicemail is confidential. Otherwise, I just need to leave a message saying, please have the school nurse call me. Does that make sense, that difference?
This is Clayton Wetzel. So I don't think I've introduced myself before. I'm at Waitsfield Elementary. And that makes great sense. And so I think that what Megan spoke to earlier is probably correct. So a lot of us have direct line with protected by a PIN that we only have as the nurse. And so if we were just to state on there, this is a confidential line, my name is Clayton, I'm the school nurse, please leave a message, then anybody that would know that that message is only going to Clayton as a school nurse. And so if that suffices for the providers, then I think that maybe we can work with Karen, because we don't have all of the school nurses on here, all the different schools, to send out a quick Google form that collects that information, because Karen can get that pretty quickly. And then if she has a way to get it out to the providers, then you would have that information also. And then it would say whether or not they have their own direct line, or if it would have to be a shared line. And that might make it easier in most cases for you to be able to leave messages.
And on the other end, is there a way, and this is a question I'm asking for the providers, is there a way for the nurses to reach you quickly without having to go through several channels and leave messages? Is there a quicker way?
No, they just have to leave a message with the office nurse, and then the office nurse will send a immediate message to me and will indicate how urgent it is. But Karen, I have another question. I also, as a pediatric provider like Anna, I'm not clear why, we send sports forms with confidential information on it. We send asthma action plans with confidential information on it all the time. And it will be much simpler for the providers to, we can take this form, and if there's permission to be in contact, or if I've gotten an okay from a parent, like Anna said, and I indicate on this paper what needs to be done, the kid is positive or not positive for COVID, they need to quarantine or not quarantine, then that just gets faxed to the school nurse. It almost seems like we're making this too complicated.
Well, it's FERPA that makes it complicated, Ellen. So yes, you can do that because HIPAA allows you to do that. If the school nurse has a question about what you've written on that form, they can't even call you back and ask you the question unless they've got written permission from the parent.
Right, but we're saying a lot of parents already have given written permission. So the preponderance of parents will already have given the school nurse permission to give a call back. But mostly it'll be like an asthma action plan or a sports form. There won't be a lot of room for or necessity for questioning. We've dealt with COVID positive or COVID negative patients all summer, and the communication with parents has been really quite straightforward. So it's, providers, we've been dealing with this since since April. So it's not something new to us. I agree the communication to the school is new, but there are pieces of this that we've been doing for several months now. I'll just unmute and wait for an answer.
Okay. We are almost out of time. So what I'm going to do is ask, the school nurses are going to let me know, how they want to be communicated with, the most secure way and the most direct way. And then if there's some other way for the nurses to communicate directly with the providers, if you can also, let me know that. Just send me an email, and if there's like a backdoor number or anything like that they can reach you, that would be great. Maria, you're going to send me that form, and we're going to take a look at that alongside the triage tool and work the two together and see what we come up with. And then I'll send that around to everybody. One other thing that we just want to touch on, and we don't have time really to talk about this, so I'm going to ask you all to just send me your thoughts via email when you get a minute or two. We've got a lot of questions from our school nurses about the temperature taking, and I just want to see what Jesse and the other providers here feel about that, because we've got a lot of misgivings about the accuracy of those infrared thermometers that they're all using when the kids walk in the door after having been, either sitting on the hot school bus or walking to school in the cold. And that's like the one criteria that the health department is holding out for them to be done at school. They're now allowing for parents to do the screening questions and submit the answers to the school, but they want the temperatures before the child enters first entry into school, whether that's the school bus or the school door. So I would be really interested in hearing what our providers think about the temperature taking, and whether or not you feel strongly that that's a necessary thing, and if you have any suggestions for them about how to do it differently, because we're going to have a lot of kids coming in the door at one time, and I just feel like it could get really bogged down with lines of kids and no physical distancing, unless we've got something really quick and easy. So I'll share that out to everybody. I'd like to hear from everyone, and then we will, keep this discussion going. I would love for us to say we're going to have time for another meeting before school starts, but I just don't know about that. I'll send a poll out to see if we can. And the other thing is that I've been contacted by the hospital about having another program to fit into the CME rotation. So, I'm thinking sometime in the fall, after we've had a few weeks of school under our belts, we could come together and then do another virtual meeting and just talk about how things are going and lessons learned and improvements that we've made. Maria, did you have one more question or comment?
I did, and I'm sorry. I did have something that was really pressing for us. I had a parent contact me yesterday that they had contacted their child's medical home and asked to talk to their doctor about getting a note to document the seasonal allergies, and the provider declined to provide a note. Mm-hmm. And I'm concerned about that because there is some state verbiage about school exclusion and allergies, and needing that documentation to be able to assess whether that child is ill or whether that child is healthy, exhibiting signs of allergies. And while I recognize that the COVID symptoms are overlapping, the majority of providers are not having any problem. We have those notes rolling in. But if we have some students who have a provider who will not provide a note documenting those allergies, I'm very concerned about that family's ability to earn a living or that child's ability to maximize their instructional time. And I'm curious if any providers have any guidance about how, as a nurse, I might be able to approach that conversation in a way that doesn't alienate this specific provider.
I would bring that up with Dr. Holmes and have Dr. Holmes address that practice.
And can I just say briefly that, you know, Dr. Holmes has said over and over at the VCHIP calls that like we shouldn't be having to write notes for everything as providers, and that it should be sort of a conversation between providers and parents. So I'm curious, you know, I think that's just an important message she's been sending since March. That's what we're hearing from the Department of Health, is that this should be more about a conversation. So
Yes,
I think that might be.
Yeah, Kathleen, what she's talking about is they have, we have in the guidance for schools, an established diagnosis of asthma or allergy that they know about is fine. They know about it. If there's a new diagnosis, like it develops over the summer or whatever, a kid is newly diagnosed with asthma or allergies that are going to present with symptoms regularly of any of the COVID symptoms, then they need to have a document from the provider just saying this child has just recently been diagnosed with allergy to what, you know, or this child has a new diagnosis of asthma. That's all they need. A phone call would be fine. They just need to have something telling them it's okay. This child, we know this child it's got, you know, this health condition, and that's why they're going to present with these runny noses all year long or whatever. So it's not like for everything, it's just for those conditions that specifically have been identified as problematic to figure out in school if they don't know that a child has or allergy. So yeah, so and you know, I don't know, really, you know, things we're saying is we're not asking providers to a medical allowance for kids not to wear masks. That's going to be a conversation between the parent and school nurse, and they have to bring the provider or the specialist into it, be writing, you know, set notes about things. It's just a new diagnosis of something that is going to look COVID. We're going to ask for them to let the school nurse know. Did you have a question?
Karen, you're breaking up, and so it's very hard.
She had to leave.
Karen, it's very
so,
hard. To hear.
Okay. So I think we're going to close. Okay. Okay. All right. This has been recorded, and we will make it available. I'm going to type.